Before we start the transfusion, I'm going to verify the physician's order, which is to infuse packed red blood cells per policy, and that was from Dr. Feelgood. I've also ensured that the patient has signed informed consent and verified that he understands why he's receiving this transfusion. Hi, my name is Carrie Ann and I'm going to be your nurse today. I just wanted to get your name and date of birth. And I'm just going to verify that with your armband. Alright, so the doctor is ordered to give you 2 units of packed red blood cells today, and that is for your low hemoglobin of 7 from your surgery that had the bleeding on your left hip. Alright, Lloyd, so we are going to double check that the blood band tag matches your blood band, and I have one of my fellow nurses that's going to help double check. Alright, we're going to start by getting a baseline set of vital signs. This is going to include your blood pressure, heart rate, respiratory rate, temperature, and your oxygen saturation. Okay. So with the blood transfusion, there are some potential reactions that can occur, so I want you to be aware of any flank pain, nausea, shortness of breath, or chest pain, and make sure you alert me if any of that happens by pushing your call light. So if any of those signs or symptoms happen, we're going to first stop the transfusion. We're then going to keep that IV site open with normal saline through new tubing. We're going to perform a clerical check and make sure the band and the blood match, and make sure we identify you again. We're going to notify the physician, the nursing supervisor, and the lab. We're going to send to the lab the blood bag, the tubing, a blood sample from the opposite arm that you were getting the transfusion in, and a urine sample. We're going to continue monitoring your eye and nose and your vital signs every 15 minutes until you're stable, and then I'll go back and complete a transfusion reaction investigation form. To prime the tubing. Making sure we clamp all the clamps. Tubing. I'm going to use normal saline. I've already clamped all of these. Blood. That one came out nice. Closer. Just cover my head. On that side. Now we're going to prime it with the normal saline. Fill this up so that the balls. And unclamp on. Alright, so now that the bag is primed, I will now stop the normal saline, and I would start the blood. So before starting the blood, I am going to make sure that your IV site is patent, and there's no sign of any local reactions or swelling, erythema, so we're good to go. So now I'm going to set your IV rate. We're going to start your blood at 60 milliliters per hour, which is 1 milliliter per minute. So new patient.
So it's 11 centimeters. So you can go to 11 and pull back just a little bit.
There we go. And then pull.
Primary bag, milliliters per hour. We're going to go at a rate of 60 to start. And there's 250 milliliters in this bag. And then I'd run. All right, now that it has been 15 minutes since the blood has been running, and that's from the time that the blood has actually was in the IV, I'm going to take the second set of vital signs. So your blood pressure is 125 over 80, your heart rate is 80, your respirations are 18, your temperature is 98.7, and your oxygen is at 98% en route. So now that the vital signs are good and you're not experiencing any of those symptoms that we talked about earlier, like the fever, flank pain, nausea, chest pain, or shortness of breath, I'm going to increase the IV flow rate to 120 milliliters per hour or 2 milliliters per minute. Since you're getting the 2 units of packed red blood cells, I'm going to be flushing the line in between the 2 units in case they're not compatible. And each unit of blood has to run in under 4 hours. So the expected outcomes for this blood transfusion are that you have no reaction, we're going to increase your blood volume, increase that hemoglobin from 7, and we're just better perfusion of oxygen. Now that I'm going to be leaving, I'm ensuring your call light is within reach, and then I'm going to lower your bed.
That happened to one of my sister's friends. She decided to go move away.
All right, do you have any questions? Okay, good.